Good afternoon, everybody. It is 5 p.m. on the East Coast of the United States, and it is February 5th, 2019. And welcome to the Hypertrophic Cardiomyopathy Association's Facebook page and our series regarding our newest Centers of Excellence. And in just a moment, I'm going to introduce you to our representative director from Scripps in San Diego. But first, a few housekeeping rules. You will be able to ask questions at the end of the presentation. If the question is very specific to your individual HCM care, we will not be able to address it here on Facebook, and we encourage you to either call the office or call the physician directly or email them. If there's any questions that you have after this presentation has been done live and you're watching it later, you can put your questions below and we'll at the office try to get back in touch with you and answer your questions. So without further ado, I want to welcome Dr. Jorge Gonzalez from Scripps. Hello, Dr. Gonzalez. Welcome to the program.
Hi, Lisa. My pleasure being here.
So I was really happy to visit you out in San Diego because we have a big need for HCM care out in that region. It was kind of left on its own for a while, but we're fixing that. And I want you to tell us a little bit about you and a little bit about why you're interested in hypertrophic cardiomyopathy.
Absolutely. So, I joined Scripps around 3 years ago when I finished all my training in the East Coast. I was trained in the Northeast in the cities of Boston, Philadelphia, and Virginia, and I came here 2.5 years ago, primarily to take over also imaging, primarily CT, MRI, which are my main interest. And I came originally from Caracas, Venezuela. That's why the accent.
Okay.
13 years ago, last month. And I joined Scripps, as I said, 2.5 years. It's going to be 3 years in August. And one of the reasons why I was interested in ACM, I have to admit, is it didn't come early in my training career. So after I went to the University of Virginia, when we were involved in some of the ACMR trials in which we are studying people with ACM, the amount of scar in the left ventricle. And after being in a city of 7 million people, in Philadelphia, I only saw a few people with that disease. And I went to a small town of 100,000 and I saw over 250 through that MRI scanner. So that caught my attention and basically highlighted that the disease is still kind of like unknown to not only patients, but also to a lot of providers. And that's why it caught my interest.
And that's a good reason to catch your interest. So while you were in Philadelphia, there's a scant number of people that show up in your scanner, but you go to Virginia at UVA with Chris Kramer, your mentor in a sense, and there's all these HCM patients in this tiny little town. That did have to be quite eye-opening.
Yeah,
we're missing something.
Definitely it was, especially when you see the statistics and you know how many patients, in theory, they should be living with the disease in the city of Philadelphia, and how little I was aware, at least, or I saw during my training.
Interesting. So I'd like you to tell us a little bit about the HCM team at Scripps. Who's on the team and how do you operate?
We have a big group. We put together several cardiologists in different subspecialties. And we have the heart failure team involved, Dr. Srivastava, who is the co-director along with me of this HCM clinic. He's one of the heart failure transplant individuals, as well as Dr. Haywood, who is the head of heart failure, Dr. Rajiv Mohan, and also as well the interventional team who are involved in procedures like the alcohol septal ablation, like Dr. Paul Tierstein, who is the chair of cardiology, and also Matthew Price and Cortes Tinnus. We also have people in the area of electrophysiology. We have John Rogers, who is the head of the pacing tachyarrhythmia therapy, and also Dr. Olson, who is an electrophysiologist. And we have also people from the Echo Lab, the director of the Echo Lab, Dr. Michael Smith, people in the generic area like Dr. Evan Muse, and also as well even in radiology. Not only I'm also performing part of the CT MRI studies, but also our colleagues in radiology, Dr. George Westby, has been fundamental in putting all those imaging techniques here at Scripps.
That's a big team.
Yes.
And you have such lovely weather. I'm surprised you guys all don't take the day off all the time and go out and enjoy it. It must be tempting. So Scripps has a very unique reputation about being cutting edge and very involved in preventative medicine. Can you tell us a little bit about that?
Yes, well, we're a big center and we're a big health system here in the region. We're ranked #1 hospital system here in the San Diego area, as well as the cardiology program, and one of the top programs here in California and also across the nation. Last year, we were the 21st, according to the U.S. News report. We have almost 30 outpatient facilities and several hospitals in the region, going all the way from the North County of San Diego all the way to the border down in Chula Vista. So we have a huge catch area of patients for living here in Southern California.
Do you have a lot of patients coming in from South America and Mexico?
I have some patients. We get patients not only from California, but also from all across the western part of the country. A lot of patients from Arizona and approximately Arizona. Also from Asia, I get patients from China, wow, Japan, and a lot of Latin Americans, especially from Mexico, of course, because we're so close to the border. But I have patients all the way from Argentina to Panama, even from Venezuela, where I'm from.
So that's very helpful to our bilingual or our Spanish-speaking population that now we have you as a wonderful resource. So I'm going to use that. Google Translate only does so much. So I'm always interested to know where a physician who is getting involved in HCM thinks our world is moving towards. What do you hope to see in HCM care over the next 5 to 10 years?
Well, primarily, hopefully, new medications. We have been using the same medication for years now, and hopefully new trials that are right now being conducted around the United States, they result in something new. There's a lot of interest, but I would say probably in the therapeutic aspect of the disease, we need more medications. And also we need more training for those physicians, especially surgeons, which is one of the things that we lack. And we have seen a big need here in Southern California is primarily surgeons who are trained, well trained with in septal myomectomies to have enough experience and try to help us in opening centers across the country.
Well, I might have a couple of tricks up my sleeve in that area, so stay tuned. The HCMA is definitely trying to ensure that there is redundancy and consistency in training, and that we make sure that all patients have access to the same high quality, high volume services that we know serve them so well. So we're hoping that over the next 2 to 3 years, we'll be rolling out some new programs that will address exactly that issue. And you'll probably be helping with some of that too, but we'll get that later. So is there anything else you would like to tell us about your center, your interest in HCM, clinical research interests? The floor is yours for a minute.
Well, primarily, I mean, my research interests have been in the advanced imaging techniques, especially anything related to CT and MRI. Primarily in the area of ACM, it's within that spectrum, cardiac MRI and the findings of fibrosis and prognosis in patients with T1 mapping and other techniques that we use in cardiac MRI. But primarily using any of those two modalities, I also, besides the ACM, also we run an aorta clinic, and also which is also a disease in the spectrum of what I need from the CT and MRI, and I rely on them on a daily basis to treat those patients.
So you're down in Southern California. Patients can drive in, they can fly in. There's ample amounts of hotel and lodging for people who need to come from far away. I know historically the area has a reputation of being a little pricey, but I've been out there a few times and found it to be very affordable if you look. So I just want people to know that just because we're talking about San Diego and La Jolla specifically doesn't mean that pricing is out of reach. And I know Scripps has contracts with many major insurers in the area, and you should be careful to look for where you have coverage and make sure that you can get there. Now, I know you're really busy. I came to visit you on more than one occasion. And what do you do when you finally get yourself out of that building with all of those pictures behind you? And we're going to talk about that one in particular in a second. But what do you do with your free time?
Well, free time, if I have any free time, to tell you the truth, which is very limited, I pretty much is all spent with my kids and my wife. Primarily, I have two very active kids, as you can see by some of the pictures. A 3 and a 5-year-old, which they keep me on my toes. Wake very early, and pretty much you will see me in some of the playgrounds around the city one day.
That's a good place to be with little ones. Now, over your shoulder, there is a piece of parchment in a large frame. Why don't you tell everybody what that is? It's kind of
this picture around here.
That one back there.
That's with the picture above is my grandfather. I'm a third generation physician family, and he's the one who started it all. He passed away 2 years ago, unfortunately, age 94. But I promised him when I was little, even before med school, that one day when I had my office, I will have his medical diploma. And so that's his medical diploma when he went to the University of Havana in Cuba in 1948. And so I keep it as an important relic.
I think that's important history right there. We don't often think about studying medicine in Cuba in the 40s, and obviously it happened, and you are the grandson of somebody who did that, and I'm sure he passed along a lot of lessons to you, and that's really amazing. I'm going to wrap up in a minute. If anybody has any questions or comments, you're more than welcome to make them now. I know it's kind of an odd hour, and a lot of our East Coast people are probably commuting home right now, so we're not catching you all. You can ask questions later, and we will put them on here and we'll get the answers. But I'm going to throw that unplanned question in there. When you come up with, and this is a tricky one, when you come up with a difficult case to manage, it's, HCM is all the same but all different. What do you go back to as your cornerstone to help make decisions for this particular patient population? Where do you look? Who do you trust?
Primarily, since we started the program here at Scripps, I think one of the most important things is it's usually do a multidisciplinary kind of like approach to every patient. And so we started doing a monthly meeting in which all the members that I mentioned, we gather once a month, 1 hour, and we discuss some of the patients we all have and make decisions. And it's extremely helpful when you have other perspective, opinions, and also when it involves procedures like ablation surgery or referring for a patient an ICD, which is one of the most difficult decisions. So I think a team approach is probably usually the best answer, and that's usually the people I rely the most, which are my partners. And if we have to have a second opinion, also we have different relationships along the region and also nationwide. And we also rely on those people to kind of like guide us in those difficult cases.
I know you were at the International Summit in 2017 on HCM, and I know you told me you found it very informative, and I'm happy to tell you that it looks like 2020 is the next year for the International Summit. I met with the Marins last week, and we're working on that, so looking forward to seeing you again at that.
For sure.
Okay, well, looks like we have a quiet bunch today. And I have hiccups with some questions. So no questions. We just have a hello from Carol, and we'll just let her pop up there and say hi. So we can get that done. If anybody has a question, now is the time to post it. If you don't have time to post it now, we can get back to it later. Dr. Gonzalez, I welcome you and the entire Scripps team to the HCMA family. We're looking forward to working with you, taking care of these patients, raising awareness, maybe even changing some legislation to help patients with HCM. Oh, Scripps is popping in, making HCM a little bit more well-known and publicized. And Scripps is jumping in, and we are now on their page as well. So welcome to our entire Scripps family, and thank you, Dr. Gonzalez, for your time.
Thank you very much.
Thanks, guys. Bye-bye.
Bye.